After drinking any of the sugar alcohols we've tested so far, what we find is that platelets clot faster. There's every reason to believe that is why we see higher risk of heart attack and stroke in people whose levels of these sugar alcohols in their blood are higher. We directly compared drinking a sweetened drink with either 30 grams of glucose, which is sugar, or 30 grams of erythritol. And what was seen is in every subject, every platelet functional measure made was significantly enhanced. The platelet is the type of cell that's involved in clotting. When one has a heart attack or a stroke, there's an inadvertent clot that gets formed in the vessels that feed either the heart or the brain. I would like to actually see some regulatory bodies reevaluate the safety of the use of sugar alcohols. They have something called GRAS status, generally recognized as safe. There is no mandate that they actually need to have certain kind of testing to make sure that they're safe, other than the bare minimum. The other thing that needs to change is labeling, because there's not a mandate at present that these have to even be labeled. What we're also seeing is that many processed foods will have sugar alcohols included in them when we test it, but not appear on the label at all. We have to be able to make an informed choice as to whether or not we want to choose a packaged food that has the sugar alcohol in it or not. What I'm recommending to my patients is to avoid the artificial sweeteners, avoid sugar substitutes, to try to eat whole foods, stay away from processed foods, and shop the produce section. Make your own food. Then you know what goes into it. At this point, based on the new study we have, I would argue in moderation, sugar or a little bit of honey or fruit is the healthier choice instead of using the artificial sweetener. Now, I recognize that diabetics or people with metabolic syndrome need to limit the amount of sugar that they eat, but you can do it in moderation and monitor your blood sugar. But at this point, I think the safer choice is the natural products, the whole food, and avoiding the artificial sweeteners.